Let's go over the most common signs and symptoms of brain tumors. One is headaches. People will go weeks to months without getting their headaches ever checked out. They'll have a constant headache, they'll take Tylenol and Advil around the clock, and they will ignore it. They'll let the headache go up until they have to go to the emergency room because the pain is so bad, and that's when they find out that their brain cancer has gotten so large it's out of control. Two is what we call focal neurological deficits. That's when the brain cancer is pressing on a certain part of the brain, leading to an impact somewhere else in the body. For example, you could have a drooping of your eyelid, slurring of your speech, or difficulty swallowing. You could have numbness, tingling, burning sensations in your right hand or your left leg. You could have all these odd symptoms that are called focal. They mean they impact a certain part of the body. Three is intractable nausea and vomiting. That means it's not getting better no matter what you do. The nausea is so severe, especially if you don't have anything in your stomach going on. You didn't eat any weird foods, you didn't eat any raw foods, you didn't eat out at all, and you're still having this uncontrolled nausea and vomiting for days and days and days. It may be worth going to the emergency room to get checked out. Four is a seizure. If you're a generally healthy person, you didn't do anything out of ordinary, and all of a sudden you have a seizure, it's worth going to the emergency room one time to get it checked out. Make sure that you get your brain scan, to get an MRI or CT to make sure there's nothing going on. Last is five. If you're having trouble ambulating, meaning you can't walk properly, if your foot is getting caught on the ground, you're having trouble with the strength, if you can't walk properly, it might be a sign that you have something going on in your brain. And this is a reminder, brain cancer is extremely rare. It's not very common. And if you do have any of these signs or symptoms, it's important that you go to your primary care doctor first. Maybe speak to a neurologist if you want to get a referral and go from there. Don't jump the gun and start thinking you have brain cancer. It is extremely rare.